Welcome to the Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have a very special guest joining us, Matthew Dunlevie from Sectorum Health. Matthew, welcome to the program.
Thanks, Tom, for having me. A pleasure to be on, and looking forward to our conversation on the virtual shift.
Awesome. Matthew, so you're one of the partners at Sectorum Health. What I like about what you guys do is you look at it, you're not a technology company, you're a consulting company. Is that fair to say?
That's a fair assumption. We're principally a consulting company, and our vision is to build a network of products and services that streamline and condense the continuum of care for patients and physicians alike. That's our job.
So we got introduced, just for full transparency, because GenieMD works with Sectorum on a couple of different opportunities. And what I like about what you guys do is you look at the performance of a health system and or a delivery of care model within a practice, and you look at it both from a financial perspective and a clinical perspective, and you ultimately try to tease out what is it that could be done better. Tell us a little bit more about what you do and how you approach business.
Certainly. You're kind of touching on a topic that I like to call clinical revenue repair, or clinically based revenue repair. So like I said, we're in the business of building networks of products and services, and we do that by taking an agnostic approach to care. So whether you're using an RPM service like GenieMD, or you are employing a particular type of Holter monitor, whatever it may be, we're looking at a variety of these products and trying to figure out if there are synergies that we can create that ultimately add value to our customers through this network of services. So when we're talking about revenue repair, and one angle that we look at is clinical revenue repair. My background is in cardiology. So if you think about a non-interventional patient walking into a cardiac clinic, their price tag's around $3,000 over the lifetime of that patient. And on average, a practice is only capturing between 5 to 10% of that price tag. So this creates some obvious discrepancies. In my mind, there are three big ones. The first is that there's a discrepancy in the coverage of the patient. The patient's paying for a lot of unnecessary and unused services that aren't being taken advantage by the practice. Consequently, that leads to a discrepancy in billing, and ultimately it leads to a discrepancy in actionable information for the patient. And being a part of GenieMD like you are, Tom, you know all about the importance of actionable information for the physician and filtering through what is important and what is not for the patient. So we look at this workflow and try and find ways for the practice and for the physician to capture more value across the continuum of care for that patient, while at the same time delivering a better patient experience.
Better patient experience. So that is certainly something that has been talked about for the last 14 years that I've been in health IT. So interesting that you call that out. So you come into a practice or large health system, and you look at it financially and you say, hey, the practice says, hey, I already have RPM, and I'm already servicing 3,000 patients on that platform. But you ultimately dig deeper, because that's quite frankly not enough. A lot of RPM companies come at it and say, hey, you can make a lot of money with RPM, right? Forget about whether the patient gets better. You can make a lot of money, right?
Absolutely.
But you got to look under the covers and be realistic about it, in that, because again, a lot of the pricing models, and you can really get caught short relative to how effective your program is. For instance, as you know, I think there was one account where, the 30% of the devices die within 90 days, right? That's a lot of churn, right? 10% of the devices are dead on arrival, right? That's a lot of churn. I'm going to have a cardiac arrest just on that particular issue. Put me in a remote patient monitoring program. All right.
Yeah. There's a
so
lot to look at outside of the
yeah.
superficial, for sure. Yeah.
So talk to us more about that. What type of feedback do you get from providers that says, "Hey, I want to look under the covers and see how effective you really are
Yeah.
in the service."
Yeah, you bring up an interesting point here. What are the physicians' questions, and what are the questions of the practice when we approach them for our services, whether it's RPM or it's a home monitoring solution or a digital health management software, whatever it may be. I've noticed personally, and you probably have experienced this as well, being in medical sales. Oftentimes, it's not that the physicians don't know what's out there; it's that they really just don't have time to vet and to screen all of these hundreds of different providers out there. And that's kind of where we step in as a trusted consultant, effectively, doing the due diligence and looking over hundreds of different providers and figuring out who we want to partner with to bring to our clients. And obviously, we think GenieMD is a fantastic platform for RPM, for chronic care management, and even telehealth as well. And the question that a lot of physicians ask is, well, I'm generating X amount per month off of my patients for RPM, and they kind of leave the conversation there. They're happy with that if they already have an RPM program, which is the topic of this current discussion. I have to kind of step back and say, okay, let's dive a little deeper here. I realize you're getting X per patient, but what does your model actually look like, and have you examined it further? Because like I mentioned, oftentimes physicians just don't have the time to think through all of the nuances of these diagnostic programs. And so they see what looks attractive to them, they employ it, and they think, hey, this is as good as life gets. When in reality, there's so many extra layers you can go into. On the RPM side, for example, cost savings is a massive, massive benefit to RPM, and physicians and even practices really don't even understand how much they're saving with an RPM program or what is an effective benchmark for savings. Another example would be HCC coding for HMO groups or value-based care. There's so many implications that RPM can provide. And RPM is just one aspect of Sectorum Health that we offer our clients. But there's so many other layers that you can dive deeper in and really help move the needle, if you will, for these practices to grow their revenue and have a more efficient diagnostic model.
So you're engaging the provider in some really good quality discussions around their financial models as well as their delivery of care models. Because I'm sure you run into a lot of physicians that say, hey, I got a remote patient monitoring program. Hey, I got a chronic care management program. I don't need you. But in reality, it never hurts, frankly, to take a quick look under the covers to see whether or not there's more to the story. One of the scenarios that I know we've talked about a lot in the past is, a remote patient monitoring platform, being, let's just say 70% effective on getting those 16 vitals, right? Or vital measure on 16 unique days within a 30-day period, right? Not achieving that is a lot of money left on the table, one. But two, you're not managing the effectiveness of one's wellness as good as you could if you were in the 90-95% tile of that measure. Is that what how do you approach that with a provider to get them to understand that not all RPM platforms and services are the same?
Yeah, I think this is a great question, and it's kind of a multifaceted answer, if you will. There's a lot of angles here. The first is obviously the RPM company itself, and we can talk ad nauseum about the different features and pros and cons of a variety of different companies and how they approach their finances, for example, or their supply chain, or how they're implementing the actual monitoring services. I think the more important discussion is around the patient experience. And if we look at an RPM company, say, for example, a hospital or a practice has 10,000 patients on RPM, and this RPM company is not integrated into their electronic health records or into their EMR, then maybe they're getting those 16 readings every month, and maybe they're achieving even 70, 80% compliance. If that data isn't being utilized effectively, you're just kind of paying for getting 16 readings, right? The monitoring doesn't serve a purpose unless that data becomes actionable for the practice. But if that data is siloed, then it becomes even more problematic to diagnose or treat this patient further on after the RPM process. And you'd be surprised how archaic, and I'm actually, you know how archaic some of these practices can be. They're literally basically copying and pasting and almost printing, scanning, and then uploading all of this information into their EMR so that the information can be carried on from one provider to the next. And that's really what providing a streamlined continuum of care looks like, is not only providing an excellent service on an RPM front or a CCM front, the chronic care management side, it's also integrating all of this data as we shift into the virtual world and move away from in-office visits and clinic visits to, I want to interface with my physician over the portal, or I want to provide my diagnostics to this practice online. Making sure that that data is being transferred across providers is, I think, the most important for the patient experience. And that's ultimately what I think a good RPM provider is doing, or any company that's moving into this virtual world should be focused on.
Yeah, the interoperability, I think you're hitting on a very important topic in the context of the overall RPM, right? Because it's not just the platform itself. It's not just about measures on or a measure on 16 unique days in a 30-day period. And it's not about the engagement. Sometimes it's more than that, right? So to your point, interoperability, both from a device perspective into the platform, as well as the platform into the EHR, so it's an end-to-end ecosystem, is very, very critical. Otherwise, you're, to your point, you're going to create data silos. And I think this is really where the industry continues to struggle. We have had several scenarios where, we want to integrate with the EHR, and to some degree, the EHRs just make it very costly to do that, or very difficult to do that in a time effective manner, because someone is poaching, if you will, into their territory, and feeling like their account is being stolen from them. So it becomes a very, very difficult play in making sure that you have that end-to-end ecosystem. How does Sectorium come about that? Right, that's a huge challenge. You got to have you're indicating that you're building a network of partners that can help affect that end-to-end ecosystem. Tell us a little bit more about that.
Yeah, and before I answer that question, I want to touch on something you mentioned earlier, which is the diversity of this market that we're in. It's just exploded over the last 3 to 4 years when it comes to telemedicine, especially in the wake of COVID. It's incredible. And unfortunately, there seems to be this divergence of data when there needs to be a convergence of diagnostics, or diagnosis, if you will. I personally believe there needs to be more of a standardized plan of diagnosis in order to create a personalized treatment plan. And so the way in which Sectorum approaches this problem is by building the network pre-integrated, if you will. So in order to become a partner with Sectorum, we're vetting all of these different groups, And we're asking the question, how do you integrate? We're asking ourselves the question, how would this company integrate with our existing line of services? And then we ask the question to the provider as well. What are you going to do to integrate with our solution? Because a physician, like I mentioned, they're very busy, as you know. And at some point or another, someone like myself or you will come along and sell them some type of product or service and promise that it's going to enhance an aspect of their practice. And I'm sure it does. But over time, as they accumulate more and more of these products, they're left with this discordant list of services that they need to now log into 8 different portals to access just one bit of data. And so instead of condensing the physician's day-to-day, it ends up ultimately expanding their day-to-day. And when we come in with our service, whether or not a physician wants to employ the entire bag of products that generates value for the entire continuum of care, or they just want to pick one item out of the bag, however many they pick, all of our suppliers and our partners, if you will, have worked together to make sure that, one, they can integrate at a baseline level with an EMR, but also that they integrate with one another. And that's where those synergies come up, like I mentioned, in this network.
Yeah, I mean, that is tough. I've again been in this interoperability space for quite a while, whether it's been through direct messaging, the HISP, HIEs. I've always said, technically, we don't have an interoperability problem. What we have is a lack of ability to understand each other and willingness to establish that interoperability. And you take the Sectorum takes the tears down the walls on that particular front, because that's a mandate, right?
Yeah, and you're absolutely right that it's not a lack of capability; it's more of a lack of will.
Yeah, exactly. And and then half the industry still has their walls up. Notably, most EHRs, frankly. There are some EHRs that are very good at interoperability and being open and things of that nature, but it is still a challenge. And to the point, a physician isn't the one that can wrestle that down. They're not interoperability specialists. They have to have a lot of trust with the people that they're bringing in to say, okay, this is what I want, and this is what I'm expecting you to deliver, and then being able to have that trust that it's going to get there at the end of the day without a lot of churn and drama and other aspects that don't impact the overall effectiveness of the business, both clinically and financially. Thoughts on that?
No, I think the question or the elephant in the room, I should say, is really who's owning the data, because that's what's making this question of connectedness so challenging. Which of these companies is going to own the data for this patient? Obviously, the patient owns the data, but where is the data being housed? Who's storing it? And there's a entire discussion we can have on ethics around this point here. But I think that's what makes this so challenging. And to be entirely honest, I don't think we have a good solution yet at Sectorum. What we've done is effectively brought the partners together, all of the different suppliers that we have, and say, look, you're going to all have visibility of this patient at one point or another along this process. And for the most part, by integrating with one solution or another, you're not really giving up any of your control over the data that you're already managing. It's more so about creating some connectedness across your pipeline, if you will.
I have to go back many years when I first met the founder of Cerner. And I was invited to their user group conference, and he was on stage, and he was talking about whether his company was a technology company or a healthcare company. And I just believed so much in what he was saying, and that we are. If you're in healthcare, you can't be a technology company. Your fundamentals might be technology, but your passion has to be delivery of care and outcomes. And if you're not there, then you might be in the wrong business, because at the end of the day, everything we do is about the patient. And if we get it wrong, the patient is the one that always suffers. whether they know it or not, that how things transpire. There's a lot of scenarios where the interoperability has failed the patient, and we just can't, and we just have to have a zero tolerance on that aspect of the overall solution. Thoughts on that?
No, I think you're absolutely right. When there is a lack of interoperability, the patient suffers. I think a great example of this is if a patient comes in to visit a cardiologist because they've got some murmur or palpitations. I'm just going to speed forward in the diagnosis and say that they've got some type of atrial tachycardia. In other words, a hard to diagnose irregular heartbeat. A provider might put them on a Holter or a cardiac event monitor to see what's going on with this patient. And turns out the cardiac event monitor is negative. They couldn't pick anything up. So what happens in the status quo? The status quo, oftentimes the physician will say, all right, come back in when you've got something else. So the downside here is that the patient loses touch with the practice, and the practice loses touch with the patient, obviously, conversely. And the bigger problem is that, speaking from a clinical revenue repair perspective, the onus is now on the patient to come back in to create revenue for that practice, but it's also the ownership is back on the patient to even come in and be engaged with a provider where they feel that they've kind of been lost. And so what we do at Sectorum is we say, instead of coming off that cardiac event monitor and going home, why don't we put you on an RPM? Why don't we monitor you for the sake of figuring out what this is? Because that does several things. Obviously, first and most importantly, it makes the patient feel cared for. It's ironic that we can be exposed to so much. We live in a world revolving around patient care, but so often patients actually don't feel cared for. And that's true. That's really where I think RPM can make a huge impact. So if these patients, instead of coming off cardiac event monitor and going home, left to their own devices, they're put onto an RPM program in continuation of that initial diagnostic, then now you're bringing the patient back into the practice. You're extending the cycle of data for your practice and creating an actionable event when that arrhythmia does come up for the patient. And in that way, the patient is directly benefited from this enhanced workflow.
Yeah, I absolutely agree. This is where I think healthcare is partially broken. Not to sound overly negative here, but
and on a high note.
So, but the point is that the patient does have a problem. You take all the time, you wait the average of 23 days to go see a specialist, and you can't find anything in that 20-minute segment that you're in front of the doctor. So you go home and it happens again and wait another 23 days to blow it out of proportion. So being able to do that wellness at home, that health at home, a healthcare anywhere type of model, that's really what RPM is all about. To your point, is let's extend the delivery of care outside my brick and mortar. Let's put leverage some technology that can monitor you in your home, in the comfort of your home or wherever you might be, and alert the physician appropriately when an event occurs, so that we can capture it and then help further diagnose the problem and get you on a path to wellness again.
Absolutely. So, and this ubiquitous model is exactly why we were so attracted to RPM, to chronic care management, to RTM from our perspective at Sectorum. Why I think in the shift to virtual care, we needed a ubiquitous care model like RPM. And so it was really a no-brainer for us, and it's been a tremendous impact. We've seen a huge impact for our physicians that we've approached on this, and they see the value, they see the benefit, and we're looking forward to delivering this to more patients.
And that is the exciting opportunity here, is that the doctors, physicians, and health systems are really starting to engage in this new delivery of care of a healthcare anywhere at any time type of model, and leveraging the services of Sectorium and their partner network to affect that model, and ultimately engage and ultimately work towards getting that patient stabilized and on a path to wellness more effectively than otherwise. I'll give you the last word.
No, I think you're absolutely right. And there are one of the things that gets me so excited about this space, particularly RPM, is that there's three players in my mind that are needed to move the needle. And that is obviously the patients, the providers, and the payers. And for the first time that I can recall, all three of those entities are lock in step with one another post-COVID. You have a massive awareness of virtual care through COVID, so patients are aware of it. The physicians see the benefits, obviously. And if you lick your finger and put it up in the air, you can see, okay, payers are also moving in this direction as well. So it's a very exciting space to be in, and we're excited to be partnering with GenieMD.
Thank you. I appreciate that. And I might add a fourth P to that. That's pharmaceuticals. So absolutely. So Matthew Dunlevie, partner at Sectorum Health. You guys are doing some great stuff, engaging the market in a much different way, and bringing solutions to the table that make a real difference. I want to thank you for your time joining the virtual shift. And I believe folks can go to sectorumhealth.com, SECTORUM health.com for additional information. Appreciate it.
Thank you so much, Tom. Appreciate it. Thanks for having me.
I want to thank the show sponsors, HP. HP Engage Long Lifecycle Products provides the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, GenieMD, providing a modular, scalable, and customizable virtual care platform and clinical services to help providers extend care into the home, increasing access and quality while driving new revenue opportunities. If you missed part of today's episode, you can tune in at the same time, 11 a.m. or 7 p.m. Eastern, throughout the week, and be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.